Hello everyone, and welcome to this audio podcast in around this series aligned to the LabZtorm Impact v.3. This is an audio podcast in around this series looking at nephrology and what, if any, are the healthcare educational needs for patients with chronic kidney disease (CKD). This is an audio podcast in around the lab, a storm robotics blockade and aligned to another storm robotics production. This audio podcast will look at and delve into some aspects in around the qualitative data integrity, reflexivity, and the trustworthiness in around process, in around the sort of research, the research sort of process and aspects. So in around qualitative data integrity, reflexivity, and sort of trustworthiness, ethics applications and documentations were sort of finalized to enable qualitative data collection and integrity. Inductive content analysis, and in around inductive content analysis, there will be an audio podcast sort of subsequently that will delve into inductive content analysis, or ICA. However, inductive content analysis, or ICA, was implemented owing to the nature the nature and sort of the basis in around the particular research question, the research in question, or inquiry. And to achieve sort of robust research, a sort of a checklist for researchers attempting to improve the trustworthiness of a content analysis study, sort of document or publication, had been referred to, and also outlines where a publication, there's literature and publication specifically that has been outlined in around attempting, where researchers are seeking to attempt to improve sort of the content analysis in around sort of healthcare research, but also in sort of around qualitative research, more specifically. And so this sort of checklist was applied in aspects of this research. And so using the checklist and evidence relating examples of best practice was a basis and of utmost sort of pertinence. Several texts were followed to ensure underpinnings of qualitative data and inductive content analysis, integrity, and in line to this, there's research and works that have been published that look into that sort of evidence, sort of the qualitative data aspects, and again ICA in context of integrity, and those sort of publications were referred to as part of the evidence surrounding this research. These references helped provide a basis and checklist again for academic rigor in around this research. At the same time, in this research, the research scientist investigator sort of encouraged involvement and discussions implementing different topic guides, and thus also providing sort of lived experiences to participants who met sort of inclusion and exclusion criteria. Telephone interviews were also used to save time. Were used to save time, encourage trustworthiness, having built initial repertoire with the RPSG, the Renal Patient Support Group, and KDARs, the Kidney Disease and Renal Support Group, or KDARs for kids, moderators through social media, through the social media platforms, and also through the workshops, the sort of high street workshops that took place. This was important. This was again important, so thus to encourage inclusion and diversity of patients. A pre-interview discussion with participants fulfilled ethical obligations, ensuring that participants were informed on the sort of nature of research and were clear on sort of the expectations in around this works. Scheduled telephone interviews were conducted to ensure high number of participants and positive sort of interview experiences. Guidance was also sought from the supervisory team and several texts to gain understanding of process flow, and to ensure to ensure sort of the academic rigor in around this works. Interviews that were conducted were balanced with an informal requirement to respond to questions asked by the research scientist investigator, and participants were informed they would receive a research summary or overview following completion of the works of this research. So part of this audio podcast was to delve into sort of the sort of data protection, the aspects in around aligned to the data protection, GDPR 2018, and privacy and storage. However, the next there will be an audio podcast sort of subsequent to this that will delve into which will delve into, or will delve into sort of those sort of aspects. And so this closes this audio podcast aligned to the qualitative in around qualitative data integrity, reflexivity, and sort of trustworthiness. This has been an audio podcast aligned to the LabZtorm Impact v.3, and in works and research in around sort of nephrology. What, if any, are the health educational needs for patients with CKD, chronic kidney disease? This has been an audio podcast series aligned to a storm lobostics blockade, and also aligned to another storm lobostics production. Thank you for tuning in.